I guess most people know his relation.
Oh, no, go home. We're going there. All right. I guess you're already filming, so we may as well just show this as part of the interview. Usually, I'm the one here at Athens Limestone Hospital about to introduce you to a doctor, but please introduce yourself to me.
I'm Dr. Ramesh Subramaniyam.
Say your last name?
Subramaniyam.
Now, do most people call you Dr. Ramesh?
Yeah.
Okay, Dr. Ramesh. All right. Now, you're a cardiology.
Yeah.
People are stubborn, mostly men. They get chest pains. They finally wind up in the ER. Is that how they get to meet you?
Unfortunately, many times, yes. But sometimes we see just referrals from primary care physicians as well for more stable patients.
So if anyone's at home watching and they're feeling like they're having some chest pains, they can contact you to get in to see you?
They can. And they can go through their primary care physician, or they can contact us, our office directly too.
Okay. Well, tell me just a little bit about you, because I know you're from Atlanta, or lived in Atlanta before you were here.
Right. I actually grew up in the north, New York, New Jersey, and then came down about 10 years ago to Atlanta for my training at Emory University, and then worked in South Alabama for a couple of years. And the CEO that was working there actually is the CEO here at Athens Hospital now, and that's
Kelly Powers.
That's how I ended up here.
So good working relations.
Yeah.
So she's bringing you here to keep it going.
I'm following her.
Well, it's going well. Well, tell us a little bit about the practice and where you're located.
I'm in the hospital itself, Athens Limestone Hospital. And our practice is primarily based at Athens Limestone Hospital, where we do a lot of the procedures. We do all of the non-invasive procedures, echocardiograms, stress tests, cardiac CTAs. We're starting to do that here. And also we're offering cardiac calcium scoring to anybody that wants to have it. It's you don't need a referral.
Tell me a little bit more about that, because I asked you, I said a calcium test, and you said in the arteries it can tell you about what blockage or if you have history.
Yeah.
Your family history?
Well, yeah, for the most part it's a useful test for people that are relatively asymptomatic but are concerned about heart disease because of a strong family history or many risk factors, you know, the typical ones including diabetes, high blood pressure, high cholesterol, smoking, and so forth. So this test is really quick, takes only a few minutes, done here in the radiology department and at the hospital, and takes only you just lay there and they take a quick scan of your chest and it tells us the amount of calcium that's in your arteries. And that's a great marker for how much blockage there is. And depending on what the score is, we can talk more about it and decide if any further testing is necessary.
I would think that's very important. Is there an age limit of when you should do that?
You shouldn't do it when you're too young. There's no need to. But anybody certainly 40 or above, we wouldn't have a problem scanning if they're interested.
Insurance works well with that?
Some insurances cover it, but it's really not designed to be a big money maker. It's just to cover the cost of the test.
Good.
There is some
I would recommend everyone do that, especially if you have a history in your. Why would you not want to know and take precautions to get
exactly. Better? It's a warning sign before, so you can take measures to prevent a heart attack, basically.
Okay. Well, how has the hospitality been here in Athens?
It's been very good. Not only is the weather warm, the people are warm too. So
they are. That's a great community. All right. Well, thank you, Dr. Ramesh.
Okay,
I'm not saying that last name. Athens Limestone Hospital. Be sure to check out their website.